Hi runners, Steve and Margot Manning. We're podiatrists and coaches from the Intraining Running Center. We help runners manage their running by providing training programs, the right footwear, injury advice, and rehabilitation management strategies. Keeping you on the road to reach your goals and enjoy running is our highest priority.
Today, we're going to talk about how do you know if you need an orthotic? An orthotic for running or just a shoe?
And there's three factors to consider. And we're going to actually use some patients as examples to explain those three factors. And the first patient came to me specifically to get orthotics. So they were sent in by their physio who said that they might need orthotics. And well, for this first situation, they didn't actually need orthotics. What they just needed was the right shoes because really their shoes were not appropriate for their biomechanics. And that contributed to their injury that they had.
So a lot of new runners or first-time runners have not yet had the experience that a lot of you may already have in knowing what shoe is best for them. You may even have a friend or a family member who's in that situation where they've just started running, they love it, but they're starting to complain about the niggles and the pains that they're getting in their legs and feet. And it's those people who first really should look at changing their shoe before changing and putting orthotics into their shoe.
It's not always the shoe, but you really should consider the fact that sometimes the shoe's worn out, sometimes it's the wrong type of fit or the wrong design, it's just the wrong shoe for them.
So that's what we do. So we get the runners to come in here. Sometimes they'll book it and see us as podiatrists because they know that they can have a little bit more thorough biomechanical analysis along with that. And then we have them running on our 25-meter track, which is in store. Other times we just encourage them to come in and see our really friendly staff who are all runners and really knowledgeable about what shoes work for which people. And so that's without having to have the podiatry appointment. Both of them work really nicely. Probably, Stevie, if somebody who knows they've had injury quite a few times, that's when it's better to come in and see us as podiatrists.
Yeah, and we actually see people just for footwear appointments. And in those appointments, we can establish whether an orthotic might be appropriate or not. We try not to push everybody into orthotics, but at the same time, you need to know whether your structure is going to lead to injuries or not. So,
and that takes us to case number 2.
That is true, because case number 2 was about asymmetries leading to structural asymmetries that led to injury, and in this case, it was lower back pain. So what we do in the clinic is we do a thorough analysis of the range of motion of the joints, the functional sort of control and strength that somebody has. We do a gait assessment with everybody, and that then directs us towards understanding what contributed to the injury and whether it was a structural thing. And in the case of the lower back pain, it was a leg length difference. So that means one leg was longer than the other, and it was to an extent that they couldn't compensate for anymore. And sometimes when you're younger, you can compensate for pretty crazy things.
Well, speaking about younger, once I did have one of my young runners who was rolling his ankle a lot. And he did have a leg length difference, which with kids, they can grow out of that. So you have to be very more mindful of that. But with the orthotic and the correct type of wedging, we were able to reduce him rolling his ankle when he was running, which was actually a really nice change. You could just focus then on running fast.
Yeah, so in those situations, you can't really get a shoe that's going to have asymmetrical support from one side to the other. And so in the clinic, what we do is after evaluating what they need, we will modify the shoe or we'll make orthotics. Because orthotics are really just a way of customizing a shoe to somebody's foot.
And then the third one is using orthotics for specific injuries.
Yeah, so people have stepped on something and hurt their foot, or they sprained an ankle, and in that situation they might in a short term need some orthotics to try to sort of compensate for that. And so when you sprain an ankle, you have lateral instability, which means it's easier to sprain your ankle again, and so we'll sometimes sort of build up the outside of the insole, or we'll make up an orthotic that has extra support there so that there's more early feedback for when they start to sprain their ankle. There's pressure against their skin that tells them that it's happening, and then they can make an early intervention when it comes to muscle contraction.
And other specific injuries such as heel pain for fat pad injuries or plantar fascia pain, that can be used to help get you through that process when it's really uncomfortable and you need just that little bit of extra support through the arch. Combining that, of course, with footwear. Sometimes if someone has pain under the first toe, big toe joint, that using orthotics is a fantastic way to help offload that and speed up the recovery process, because the worst thing possible is when you have a big toe joint that is being loaded all the time when you're running and you're walking, and to not have a way to take the pressure off it. So that's where you use the orthotic to help.
But really, when you make those sort of little modifications for something that's sore for some reason, it could even be like a plantar wart or something that you're creating a little cavity for. Once that's healed up, you can actually remove it, because the great advantage of the orthotics that we make is that you can easily tweak them. So the modifications that we do can be adjusted.
Yeah, so just chat on that a little bit further, Steve, because the orthotics that we make are designed really for using for sport.
Yeah.
And for whether it's walking, running, footy, tennis, whatever it is, they're designed to be customized so that you can actually have that dynamic movement in your shoe and able to be comfortable with that.
Yeah, so the common sort of older type of orthotic is a rigid piece of plastic in the back 3/4. It can't be full length rigid because then you can't flex your foot. But the problem with those is that in activity, such as running and walking, as soon as you go into propulsion, there's no force going through that type of orthotic, so it's not really doing anything. A lot of the problems that we find with our runners is during propulsion. It's not so much at heel strike or during mid stance. So that's where you really need to have a full length orthotic. And once you have them, as I said, they're just so easy to modify. You can sort of see with this one here that it's thicker on that outside bit, and it's actually a little wedge that goes across the foot, similar to that. But that's what sort of.
So you can really customize the designs with them. And actually, this is one of the best parts about using these types of orthotics. Is sometimes they just don't quite work when you first have them. Like, as in you might get a bit more uncomfortable, or you get a few blisters, and they are so modifiable to suit and adjust,
to tweak, yeah.
And as you go. And as Steve said, it can be once you've actually recovered from your injury, you can adjust it differently. Again.
So the real issue here is that we're doing a more static analysis of what their foot needs, and particularly when it's sort of heat molded to their foot or they're casted or scanned, that's a static capture of their foot. And in a functional sense, when you start to run or walk, then your foot actually can change its shape as it moves through the gait cycle, and for some people more than others. And so that's where we need to be able to tweak the orthotic.
Steve, one of the more common questions that we get asked, and we were talking about this beforehand, is people asking, do orthotics make my feet weaker?
And there's actually evidence to show that if you can put your foot into a better position, those muscles can start to work properly again, and your foot will actually get stronger. And that means even without the orthotic, it might be a little bit stronger.
And the other one is, other question that often comes is, am I going to have to wear these forever?
Yeah, well, I think that's probably not the case in many situations. Once you're over your injury, you won't necessarily need them forever, but there's other people that if they have those structural problems, then you're going to probably always need it if you're wanting to be active. And the orthotic will allow you to have a higher level of training threshold before you start to get injured. The other thing is, I just should mention, is that once you get orthotics, some people just feel like they're so much more comfortable, and so keep using them anyway.
So runners, there's 3 reasons why you'd probably want to come and consider having orthotics. The first is if you are continually having injuries. The second is if you know you have biomechanical or anatomical problems that are contributing to the niggles and the injuries that you're having, or you keep rolling your ankle or other little factors. And the third one is if you reach that threshold in your training, when you get to that point, you start to break down. So if you like what we have been doing in our run talks, make sure you share it with your friends and subscribe to our YouTube channel.
We love running.